Have you ever really thought about what happens when you're put to sleep for surgery? We use that phrase, put to sleep, but what's actually going on is so much deeper, so much more of a mystery. So today we're going to pull back that curtain on the science of anesthesia, from its pretty terrifying beginnings to the incredibly sophisticated and frankly still not totally understood science we have today.
I mean, really try to picture it. Before the mid-1800s, surgery was an absolute last resort. It was a conscious nightmare of pain. Patients were literally held down, surgeons worked as fast as they possibly could, and your chances of survival, not great. This was the problem, a brutal, horrifying reality just waiting for some kind of miracle.
And then, that miracle finally arrived, and it came in the form of a few pretty simple gases. This was the first real revolution, a time of just mind-blowing discovery that was about to change medicine forever.
The pace of innovation here was just astonishing. Think about it. In just 5 years, between 1842 and 1847, ether, nitrous oxide, and chloroform all just burst onto the scene. All of a sudden, painless surgery was actually possible. And it was diethyl ether, first used by a doctor named Crawford Long, that really kicked off the whole anesthetic age.
But, that first miracle was deeply flawed. Ether was a crude tool, to put it mildly. It made patients produce so much saliva they could sometimes choke on it. It could cause the voice box to spasm, literally cutting off their air. And maybe worst of all, it was incredibly flammable, a huge risk in operating rooms that were still lit by open flames. So yeah, the solution created a whole new set of pretty scary problems.
Okay, so the next chapter in this story isn't about some lucky, accidental discovery. It's about deliberate, focused design. This was a full-on scientific quest to engineer the perfect anesthetic, something that was safe, something you could control, and something that was predictable. And the secret weapon in this quest? It was a chemical process called halogenation. The best way to think about it is like a molecular toolkit. Scientists figured out that by adding elements like fluorine or chlorine to these compounds, they could basically tweak their properties. They could make them less flammable, way more potent, and just a whole lot safer.
And the results of all this engineering was, well, dramatic. Just look at the difference here. You've got the old school ether on the left, and on the right, you've got halothane, which came out in 1956. Halogenation took that flammable, unpredictable molecule and turned it into a non-flammable, super potent anesthetic that was way easier for patients to breathe in. It was a quantum leap in safety and control.
But the search still wasn't over. I mean, science is never that easy, right? Halothane, for all its amazing benefits, turned out to have a dark side of its own. It could cause rare but really serious liver damage and mess with heart rhythms. So every step forward just revealed new challenges, pushing scientists to go back to the drawing board and refine their designs even more.
This chart tells a really interesting story. You can see this golden age of discovery from the 50s through the early 80s. A ton of new drugs came out. But then, look, the pace just slows way down in the decades after. So why is that? Well, in part, it's because the drugs they developed during that boom, like sevoflurane and desflurane, are just so incredibly good and so safe that the urgent need for something totally new has gone down. We just got really good at this.
But for all of our success in figuring out what these drugs do, a huge, profound question is still hanging out there. How do they actually do it? And this, my friends, brings us to the central mystery of anesthesia, which is really the mystery of consciousness itself.
I mean, this quote from our source material really says it all. After more than 170 years of using these gases, the precise way they flip the switch on our consciousness is still, fundamentally, a puzzle. It remains elusive.
For a long time, the best clue we had came from something called the Meyer-Overton rule. Scientists noticed this really interesting pattern. The more easily a gas could dissolve in oil or fat, the better it was as an anesthetic. And that suggested that these drugs worked by sort of dissolving into the fatty membranes of our nerve cells and messing up how they work. It was a neat, elegant theory, but as it turns out, it's only a piece of the story.
Today's view is way more complex. We now know there isn't one single off switch for consciousness. Instead, these anesthetic molecules are more like a master key. They travel through the body to the brain and spinal cord, and they fit into lots of different locks, all these different protein receptors and ion channels. This is why anesthesia isn't just one thing. It has different parts like amnesia, being unconscious, and not being able to move. and each of those effects is controlled at different places in the nervous system.
So that brings us right up to the present day. How do anesthesiologists use all this incredible knowledge to keep patients safe? And what are the big questions that we are still wrestling with?
Well, the key metric in modern anesthesia is something called MAC, which stands for minimum alveolar concentration. You can think of it as a universal ruler for measuring how strong these drugs are. It's the standard dose, basically the concentration of gas you need in the lungs to keep half of all patients from moving when a surgeon makes an incision.
And just to see how precise this gets, take a look at sevoflurane, which is one of the most common gases used today. Its MAC value is right around 2%. That one simple number lets doctors compare all these different drugs and dose them with incredible accuracy.
But here's where it gets really fascinating. That standard dose, it's not one size fits all, not even close. A patient's own body can totally change how much they need. Things like your age, your body temperature, being pregnant. And get this, even having red hair can change the amount of anesthetic you need. Our bodies are these dynamic systems, and anesthesia has to be tailored perfectly to them.
And all this talk about safety and individual needs leads us to one of the most critical questions in the entire field today, especially for any parents out there. What do these powerful drugs do to the brains of very young children?
Now, this is a very real concern, and it's based on solid science. The FDA has actually issued a warning about it. This came from studies in young animals that showed if they were exposed to anesthesia for a long time, or over and over, it could trigger a process of nerve cell death. So, of course, the medical community takes this extremely seriously. However, and this is a really important however, when we look at the big studies on human children, the picture becomes much more reassuring. 2 huge studies, the PANDA and GAS trials, looked at thousands of kids, and their findings were pretty clear. A single short dose of anesthesia in early childhood doesn't seem to have any negative effects on things like IQ or cognitive development later in life.
So we've come on this incredible journey from brutal conscious surgery to this exquisitely controlled, engineered state of unconsciousness. We've created drugs that can safely turn off our pain, our memory, and our awareness, and then turn them right back on again. And yet, in doing all that, we've come face to face with the biggest mystery of all. What even is consciousness? The next great breakthrough in anesthesia might not be a new drug. It might just be a whole new understanding of what it means to be aware in the first place.